Hello, my name is Mike Cashman. I'm going to be talking about why everybody in Bolton, Blackburn, Bedford, Corby, Wellingborough and other B1617 COVID variant hotspots should be getting the vaccine, everybody over 16. Why the government should be acting on this, and if they don't, what you can be doing about it anyway if you live in one of those areas. Why am I saying this? It's because everything that I've heard that gives the opposite argument has failed as far as I can see to take account of the maths. What do I know about it? Well, I am a maths graduate, but the maths is actually fairly basic and I will explain it to you. I spoke first in Radio 4 Any Answers on Saturday, that's May the 15th, and Anita Anand, the presenter, said that was a very meaty first call. I will put a link to the radio programme and to a transcript of it on my blog, which I've had prepared. I also, as it happens, had a role in the eradication of Ebola from Sierra Leone. I wasn't front line, but I was looking after the budget for a significant part of the programme, going through that line by line with DFID in Sierra Leone, working out what we should be doing and why. So I do have a bit of insight. But surge vaccination in those places. I started off on Any Answers explaining that we are in exponential growth, it appears, because the cases of the variant have tripled over the course of a week. And if they go on tripling, that creates what we call exponential growth. It grows very, very rapidly. It's a little bit like going almost in a straight line and then suddenly going very sharply uphill. And the reason why I'm so passionate about we need to do this surge vaccination is when you've got exponential growth, what you can do early on has got a fantastic capability to nip things in the bud. We have been progressing steadily. It's a little bit like, as I said on the radio, we're as if we're building a dam. And we're working steadily, evenly across the whole thing, strengthening each bit of it as much as we can. And that's fine, and that's probably a sensible strategy in that circumstance. But when the dam springs leaks, then at that point, you need to give attention to those leaks, plug those leaks, otherwise the whole dam will burst. Look at this graph of exponential growth. Now, some people have said, well, trouble with surge vaccination is vaccines don't take effect for 3 weeks. Look, if you could stop the effect of what happens 3 weeks from now, then you make a dramatic difference to preventing the spread of a variant. Now, we don't know for certain how much vaccination prevents infection. That's true. But think of the precautionary principle. Dr. Philippa Whitford MP made this point, I think, in Any Questions, BBC Radio 4 on Friday. If you're on a train track and you think there might be an express train thundering towards you, you don't wait until it's close enough for you to identify exactly what it is. You get out of the way. That's the precautionary principle. You take the action that's most likely to save lives. So, the fact that the vaccine doesn't take effect for 3 weeks is not an argument against. I think people are stuck in their previous arguments. There's this argument that, well, we're working strictly by age because that's the way that we save most lives. In normal circumstances, yes, but not when you've got a new variant emerging. Do you remember the Kent variant, where there's a particular focus on it really in December? As this new variant of concern. By the time we were into early 2021, coronavirus was the Kent variant. It had displaced everything else. That's the situation that we could be facing with the B1617 variant, unless we take action now, because we've got the capability to do that. There are, in those places, not an enormous number of people who are unvaccinated. So the argument has been advanced. Well, the trouble with surge vaccination is if you favour one place rather than another, is that fair? What about the people from the place that isn't getting the vaccine that are missing out on their vaccine? Look, The total population of the places that I've quoted, Blackburn with Darwen, Bolton, Bedford, Corby, Wellingborough, is less than 1 million people. The number of unvaccinated over 16s is probably less than 250,000. The daily number of doses of vaccinations being given is 500,000. We're talking about half a day, at most a day's worth of vaccine being concentrated in those places. So we're talking about a net delay, when you average it out over the rest of the country, if you have a delay as a result of this focus on these places, a net delay of at most 1 day. Isn't that worth doing in order to have a strategic impact on doing the best you can to prevent the spread of the B1617 variant? Matt Hancock said, but the people who came forward with cases of the variant so far are all people who are already eligible for the vaccine. Well, that's fine as an argument for saying, look, if you are eligible for the vaccine, do come forward and get it. But he's looking backwards, not forwards. Looking forwards from here, there are many more people who are not yet eligible for the vaccine, who stand a danger of becoming infected, who stand a danger of contracting COVID, and some of them, not as high a percentage, but some of them dying or having long COVID. Isn't that worth preventing? Perhaps not tens of thousands, as in January, February, March, but if it's thousands, hey, look, even if it's hundreds, if there's something that we can do that's straightforward, that will protect people, isn't that worth doing? So, in my view, the NHS should be inviting everybody over the age of 16 in these B1617 hotspots to come forward for a vaccination now. Some of the other suggested changes, I can understand why they didn't do. The data might have been complex. This is simple: postcode and age. Now, it looks like people are actually voting with their feet. So there's been discussion of this over the last few days. I think it was the Blackburn Director of Public Health said anybody who comes forward, who gets in that queue, will get face-to-face with a clinician and they can discuss their need for the vaccine. We saw the thousands of people, I think it was 6,000 queued up in Bolton, given the opportunity. So people are voting with their feet. And the more of that, in my view, for the reasons that I've given, more of that, the better. Be better if everybody was invited. But look, if you're in one of those places, Bolton, Blackburn, Bedford, etc., Corby, Wellingborough, if you're in one of those places, I would suggest get in the queue. Look at the criteria on the government website, because it's not just over a certain age. We're talking about health workers, care workers, people who are carers. There are all sorts of circumstances, any exceptional individual circumstances. Make your case, because let's not think of this as being, as one person or one area being selfish. You're not. You're doing this for yourself, but you're also doing it for the benefit of the whole country. JCVI guy on Newsnight last night said we have to be strategic and think of the other areas. Yes, but vaccinations there in other areas are having an incremental effect. Vaccinations that prevent infection in the hotspots could be having an exponential effect. Right? If something is tripling weekly, in 5 weeks it multiplies 243 times. Wouldn't it be good to cut it off before the start of that infection, even if that's 3 weeks from now? Maybe there should be some additional lockdown for a short period while that surge vaccination is taking place. I'm up for debate on that. But look, I've been quite passionate about this, as I said. Okay, there may be some detailed mathematical models that say the opposite, but to be honest, from what I've heard from Matt Hancock, Boris Johnson, JCVI, anybody advocating the current strategy, I haven't heard it. And the argument that I've put forward is, to my mind, a powerful argument for saying, if you're not certain, the best thing to do is to vaccinate all the over 16s. I'll put a link on the screen to the Any Answers radio programme. So I have developed my thinking a little bit, done some more calculations since then, but there's a good interaction between myself and Anita Anand at the start of any answers. And I'll put a link to my blog where I've prepared a transcript of that interview. Missing out the ums and ers, but sorry, you've still got them in the video. In case you prefer to read rather than listen. But it's a good interaction, I think, worth following. So, message is, government, NHS, please invite everybody over 16 in the affected areas to have the vaccine. It will pay off, unless you've got a mathematical model that says otherwise. Looks to me like it would pay off. If you're in those areas, get in the queue and get yourself vaccinated, and encourage your friends and family to do the same. Thank you. I'll put a few other relevant links on the screen at this point. All right, I've had my say.